This is Dr. Someshwar from Shield Healthcare. I hope everyone doing good. And I welcome you all on to the Menopause series by Dr. Payal Bhargava, a co-founder of Divine Magic Foundation. Before starting the talk, let me take privilege to introduce Dr. Payal Bhargava ma'am, who is a postgraduate diploma in ART from and reproductive medicine from Kiel, Germany. And she did her fellowship in infertility from IMA Hyderabad, and she is a life member of IMA Menopause Society India and PCOS Society India. She is a member of Managing Committee of PCOS Society India and co-founder and director on board XPS Analytics Private Limited, and consultant at Sri Krishna Diagnostic Center, and also consultant at Pranada Hospital, Hyderabad. And she is a co-founder for Divine Magic Foundation, a public health and awareness initiative working at grassroots level and digitally through its YouTube channel. Now, without much further ado, let me turn over the time to Dr. Payal Bhargava to take over the session.
Good evening, all, and welcome to our 13th episode of Sailing Through Menopause. In the previous episode, I spoke about urine infection, which is very common in women, and how to manage it. Today, I'll be talking on another very important topic, that is COVID and menopause. The menopause transition and the time afterward are important periods for implementing lifestyle and behavioral changes to ensure that each woman maximizes her health moving forward. COVID-19 pandemic has made the emotional symptoms of the menopause worse, with 32% of them having exacerbated physical symptoms and 43% of patients having emotional outbursts. The experts warn that this has exacerbated feelings of isolation. If you're going through menopause during the COVID-19 crisis, or if someone you love is, you may be wondering if the novel coronavirus affects menopausal women. Are menopausal women more at risk? Are there ways to decrease the risk? These are two important questions which we need to discuss today. COVID-19 is not likely to be a significant additional risk to menopausal women per se, but menopause is a time women begin to have increased risk of heart disease and type 2 diabetes, metabolic syndrome, and other comorbidities. Once they lose the protective effects of estrogen, these comorbidities definitely increase risk of women who may contract COVID-19. So let's see what's the effect of reduced level of estrogen and COVID-19 in menopause. For women in menopause, a decrease in estrogen could potentially cause increased vulnerability to severe symptoms. There's some investigational research data suggesting estrogen may be somewhat protective for women exposed to the coronavirus. Increased age, heart disease, diabetes can all increase your chance of being severely ill with coronavirus. More so, weight gain, which may be caused by menopause, can also complicate matters if you catch COVID infection. Menopause itself impacts immunity. Immunity is a complex issue that is impacted by multiple factors, some of which we control and some less so. The hormone estrogen is shown to have a protective role in women, so women who are not on hormone therapy during menopause might be more at risk than those with a decline in the level of estrogen. Menopause is also linked to cancer risk as well as decreased in T cells, which are protective towards the immune system. The immune system cells that work to fight off cancer cells and foreign invaders, which bolster the immune response in general. Inflammation is yet another issue. According to studies, as women age, inflammatory levels increase, leading to pain, autoimmune issues, weight gain, and susceptibility to illness. So it is not that menopause in and of itself can put you at risk, but the health factors associated with menopause can create complications. So what can we do right now to increase our immunity and help us cope with COVID infection? The first and the most important thing is consult your doctor. The other factors that we can take care of are the lifestyle modifications, protect your body and keep yourself healthy, take proper therapy, eat well, embrace the movement, stick to a routine or establish a new one, practice good sleep hygiene, and give yourself a break. Now let's discuss each one of this in a bit detail. Aside from consulting with your doctor about any potential health issues such as heart health and diabetes, engage in healthy lifestyle activities that can help you stay healthier during menopause and during quarantine, when health issues are compounded by both loss of routine and chronic anxiety. So the first and the most important thing that we can do is have a balanced diet, which consists of a lot of fruits and green vegetables, some dairy products, pulses and beans, and rice and chapati. Menopause can also bring with it some frustrating weight management obstacles, coupled with the fact that quarantine and other pandemic stressors, such as loss of income, can cause the stress hormone cortisol to exacerbate health issues and further weight gain. It's important to prioritize caring for your body at this time. Eating whole plant-based foods, more of vegetables, nuts, legumes, seeds, and fruits. These foods assist both immune health and weight management. The other important thing is keep moving. Movement is critical, but you don't need a gym with an expensive equipment to make it happen. With most of us at home, it is more realistic to do multiple brief exercise interludes in the day. You might think of resistance work using your own body weight, weights, yoga, stretching, a brisk walk, hiking, or cycling while maintaining social distancing, of course. You can even set up a virtual workout session with friends on FaceTime or Zoom. The next important thing is having practicing a good sleep hygiene, a healthy bedtime. When women go into menopause and their hormones are out of balance, they may have trouble getting to sleep and staying asleep. Sleep really helps your metabolism, so not getting the right amount and type of sleep can really affect your ability to lose or maintain weight as you age and in time of stress. Get into bed early, aim for 7 hours, and make your bedroom a place where you can achieve undisturbed sleep if possible. So the other most important thing is give yourself a break. Introduce self-care into your daily life, even if it's only for a few moments each day or scattered throughout your day as small breaks. The benefits of self-care are multi-layered. While they can help us feel better when everything around us seems chaotic and uncertain, allowing us an outlet to express emotion or find solace. Stress management can also help to reduce physical inflammation. It is a win-win for body and mind. If all of these feelings are overwhelming, know that you are not alone and that you can take control of your health and wellness with the proper care and lifestyle adjustments. Introduce small, doable changes each day and stick to them. Hold yourself accountable, but be self-compassionate and patient with yourself as you adopt any new lifestyle changes. Now, the last and the most important thing is consider hormone therapy. As we all know, estrogen is an important hormone and which can be replaced by hormone therapy. Fewer women are dying from the virus versus men, and that estrogen may be a factor. Hopefully will lead to a better and broader understanding of our immune systems, gender differences, and to be better able to inform women on making those treatment decisions. If you are having bothersome menopausal symptoms, check with your doctor about what hormone therapy could be right for you. There are more safe and low-dose options available than ever before. So the risk of death from COVID-19 for women more than 50 years taking hormone replacement therapy has been shown to reduce by more than 50%. Low estrogen and low testosterone in women are likely to be associated with long COVID. Anecdotally, many women with long COVID have improved with estrogen and testosterone replacement. The majority of women have more benefits than risks from taking HRT. So what is long COVID? Long COVID, sometimes called post-COVID-19 syndrome, occurs in some people who have had an infection of COVID in the past and have symptoms which last for more than 12 weeks and are not explained by an alternative diagnosis. In women who develop COVID-19, being postmenopausal has been independently associated with more severe infection. The largest group of patients with long COVID-19 appears to be women in their early 50s. The average age of menopause is 47 in India, and the majority of women are perimenopausal in their 40s. Many of the symptoms due to long COVID are similar to perimenopausal and menopausal symptoms. Similar to other post-viral syndromes, long COVID is more common in women, with those coming to the end of their reproductive lives seem to be particularly affected. It is likely that the coronavirus directly affects the way the ovaries work and produce hormones. So even after you have been vaccinated against COVID-19, you must keep taking precautions like wear a mask properly, maintain distance of at least 2 meters, avoid crowds and poorly ventilated spaces, wash and sanitize hands frequently. Thank you so much for your patient hearing.